But I remember going to the pain clinic and asking her if I could have my arm amputated because I just couldn't bear my life like that anymore. And I just said, what would it be to have my arm amputated? And then I could just get on with my life and the pain wouldn't be there.
Welcome to the Heal Differently mini-series with me, Richard Flook. I'm your host, and today we're going to be talking about pain. Now, if you've never been in pain, you are incredibly lucky. And if you've been in pain for some chronic illness or because of a muscular thing or herniated disc or a dislocated shoulder or a twisted ankle or something like that, then this is really going to be useful for you. And there are many ways that we can experience pain, but pain can really make one's life totally and utterly miserable. And today I have one of my great friends, Jonathan Shaw. He's from the UK, and we've been friends for many, many years, and he is fantastic with assisting people with healing differently when it comes to pain. Jonathan, welcome. Great to have you here.
Hi Richard, thanks for having me.
The first thing I'd like to actually say is why do you think it's important that they heal themselves differently? I think people are asking that question. What's different? Why can't people just take drugs?
I think solving of pain is really important. I think there's too many people in the world who are suffering these days, and pain is one of the biggest reasons people suffer all around the world. I think there's 100 million pain sufferers in America alone, and that's more than cancer and heart disease put together. It's become an epidemic, and it doesn't have to be that way. You can actually solve your pain, but the reason most people don't is because they either get told they can't, so they end up living on medication, or they get given the wrong diagnosis, or they get given the wrong treatment. And a combination of those things keep people stuck in pain. They keep stuck on medication, and they just have to live with it, and they're not really living and enjoying their lives like they could be.
And you have a mission as well, don't you? Which I think is a really great mission.
Yeah, my mission is to help 1 million people become pain-free. And my vision is that one day there will be no pain and suffering in the world. I do believe that one day we will grow out of that pain and suffering world, and we won't suffer anymore. We won't have chronic pain. We won't have illness, and we will live just happily, healthy lives. But to do that, we need to change the way we view pain. We need to change the way we look at it so that we can solve it for people.
Let's just look at that question that you really posed in a minute, because I think people would just like to know, why did you get into this? How did you get into this?
I kind of fell into this. It was kind of by accident. When I was 21, I had a nervous breakdown, and I went to my doctor, and he told me to get a hobby. So I did. I went ice skating. And about 2 years into my ice skating, I absolutely love ice skating. I still ice skate today. About 2 years into my ice skating, I developed a problem with my left knee. And I went to my doctor, and he told me I had housemaid's knee. And that housemaid's knee, for those of you who don't know, is apparently caused by bending down or kneeling down on the floor. And basically what happens is that the knee swells and it gets fluid in it. The problem with that is that my job at the time, I was a children's entertainer, and I had to get onto their level to entertain them, so I couldn't not kneel down. So I went to the therapist, and he showed me it wasn't actually housemaid's knee. It was actually my back was out of place, and my body weight was being pushed all down to my one side because my back was twisted. And when he untwisted me and he showed me how to stand correctly, which was the most important part, the pain went away, and I've never had knee pain since. And since then, I was fortunate enough to have him take me under his wing and teach me the body work that I do today.
There's something else that you do that's very different as well. I'd love if you could share that too.
A lot of people, they just do body work, but a few years later, in my mid-20s, I developed a chronic shoulder pain, and that's when I came across the idea that stress affects us. And I learned exactly how stress affects us when I actually did your course, Richard, on mental health. And then later on, I learned ACE from you. And I've learned that actually one of the fastest ways to heal pain is actually to clear the shock and the trauma and the negative energy behind it. And when you do that, pain heals very quickly, injuries heal very quickly, and you can get your life back really fast.
So let's just cover a little bit more of the theory behind that. You just covered some of it, but what really is going on from your perspective when someone has an issue, whether it's a chronic one or just an acute pain? What do you think is going on, especially with the underlying stress?
A lot of people, when they experience pain, they always blame something outside of them for the pain. They blame the box they lifted, or the pillow they slept on, or the car accident they had. And it always amazes me that they do that. What's really going on with pain is that something is happening inside of you. It's usually 90% of the time a shock or a trauma that you've had in the past. It doesn't have to be a big shock. I'm not talking about a massive thing. It can be a simple little thing. In fact, one of my clients, he came to me with lower back pain, and it was something as simple as his girlfriend criticising his car. And that's all it was. It was something minor, but his car to him was his baby, and because it was one of his core values about you don't insult people about their things they love. She insulted him, and it hit his lower back. And when I got rid of that shock and then just give him a bit of physical treatment, his back was fine. So it doesn't have to be a big shock. It can be a very small thing. But if it shocks us, if it's something unexpected, dramatic, isolating, no coping strategy, that sort of thing hits the body in different places and affects our health and our well-being.
Because we heard from Libby, and Libby's story is absolutely amazing. We'll cover Libby in a little bit more detail. How did someone with severe chronic regional pain syndrome, what did you do there on more of a theoretical side?
The Libby's particular case was quite extreme. She'd had it for 19 years before she found me, and she'd kind of given up hope of getting rid of it. She tried lots of things and nothing really worked. But it took quite a few, it's about 9 months in total to solve it. But we had to use a multitude of techniques. We used ACE a lot to get to the energy of the problem. We used a bit of tapping and a few other bits and pieces to clear out the beliefs and the trapped energy and the trauma that she'd experienced as a child, and also experiences as she got older as well.
So there was quite a lot going on in the arm and the back that was causing a lot of this underlying problem.
When Libby first came to me, she didn't come to me about her arm at all. She came to me with sciatic pain. And Libby lives in Leeds, and I live in Essex. And for those of you who don't know, that's about 4 hours of difference driving. So I had to see her to find out what was going on with the sciatic pain. So her husband drove down to me in Essex, and I looked at her. But when I looked at her sciatic pain, the only way I could actually solve that was to solve the CRPS in Libby's arm. Now, Libby's CRPS was brought about by a car accident that she'd had, and injured her wrist, her left wrist. And then she'd had 2 operations on it to try and fix it, but they were both unsuccessful. And then gradually over the years, the pain went up her arm, into her shoulder and her neck, and down into her back a little bit. And the arm had actually also locked, bent. It wouldn't straighten. It was just locked in place. So she couldn't use it. She couldn't hold her children's hand. She couldn't swim or ride a bike. She couldn't even cut her own food. When she was out with her husband had to cut her food for her. So it was quite a severe case.
And what exactly did you do? Because I know that she came up with sciatic pain, which is lower back pain, trapped nerve in the back. And also then, as you said, you had to deal with the CRPS. For people who don't know what that is chronic regional pain syndrome, which was in the left arm. What did you do that was different?
You get a couple of types of people. You either get people who just clear stress, or you get people who just do body work, or just do rehabilitation, or don't do anything. You really have to do a combination of all of it. So to begin with, I released the sciatic nerve for her, and so she walked out, pretty upright. But then over a period of a few weeks, we worked on Skype, and we had to get the trauma out of her arm. There was a lot of trauma in there. It wasn't as simple as just finding 1 or 2 Udin moments. It wasn't as cut and dry as that. There was a lot of trauma. There was a lot of limiting beliefs, a lot of fear about letting the pain go, a lot of fear about who she would be without it. It had become her identity for a very long, long time, and she'd built her whole world around this arm. She was out and about. She had so many coping strategies in place for not shaking people's hands and not letting them bump into her and things. It really became her identity. So we had to get rid of all of that as well. So it's when people have chronic conditions like that, it's not as straightforward as just clearing shocks. You have to clear the identity conflicts and the fears and the worries and everything.
How would you work with someone like me? Would you just work over Skype, or would I have to come and see you? How does your work, is it different from, say, other people?
I do like to see people in my clinic because the main problem is that a lot of people get misdiagnosed, and I don't know always what's going on in the body. So for instance, if someone says to me they've got frozen shoulder, well, they may have frozen shoulder, but I don't know what else has happened in the body since the frozen shoulder. It may have worked down into the ribs or the lower back. And if I don't know that, I can't find the exact stress that's in the body that's causing the problem. And I also can't fix the physical element of it. You really do have to fix the stress and the physical and the posture and the movement all together in a lot of cases. Not always.
And how do you go about doing that? Because we've had conversations before and you've shown me some of these things, but your way of working with a client, let's say the client turns up with a frozen shoulder, which honestly, from a medical point of view, is practically almost impossible to heal. You have to give them steroid injections and that may help, but they still don't get the use back of their arm. It just takes a year and a half, maybe 3 years to eventually solve. How would you go about doing that?
If we're using frozen shoulder as an example, you can do it in different ways. Yes, you are right. Traditionally, a frozen shoulder takes at least a year and a half, if not longer, to heal. That's not actually true. I can heal it usually within anywhere from half an hour to 4 months, depending on which way you let me heal it. So if you're open to finding the stress that's created it, I can heal it far quicker. If you're not, then it just requires body work and the right type of body work. There's a misunderstanding about frozen shoulder. So what I would do is, if someone comes to me with frozen shoulder, I would take a full case history, finding out what's happened to them in the past and what else may be contributing to it. And then I will examine them, and I will examine their whole body, not just their shoulder, their back, their ribs, their neck, even their legs, and see what structures are affecting that shoulder. And then I would clear the trauma from the shoulder, and then I would work the shoulder, get it loose, get the muscles loose, get the flexibility back, get the posture back, get the movement back, and then get the strength back, and then the shoulder would be healed.
You've also talked in previous conversations that we've had about working with people and using a technique called palpitation. It was a technique you learned, I believe, from your original teacher. Can you share a little bit about how you do that?
Palpitation was an awesome skill I learned from my therapist. And it's very difficult to explain. In a nutshell, all I'm doing is putting my hands on someone's body and I'm feeling what structures are a problem, what structures are damaged, and what structures need fixing or there's a problem in that area. And unfortunately, doctors don't seem to be trained in that very much these days. They used to be in the old days, but they don't really like to touch you. I like to put my hands on someone and feel what's going on. I'll give you an example. I recently treated a guy with frozen shoulder, actually. He told me he had frozen shoulder, but when I put my hands down his back, I could feel that he'd actually got trapped tissue between his ribs, and he also had a lot of tension and tightness in his lower back, which meant that the shock he was going through wasn't just about the shoulder, it was about his rib cage and protection, and also about his lower back and his core values. I would never have known that unless I put my hands on him.
You showed me exactly how you did that. Can you just quickly show people?
I mean, all I do is I just put my hand gently on the areas of the body, and I just move my hands around, and I'm just feeling what's going on. I'm feeling the energy of the problem. Obviously, I can't reach in and feel what's happening, but I'm feeling like the vibration. Every tissue or structure has a different vibration and a different feel to it, and I've just learned in years what those things feel like, and how they feel when they're damaged or injured in certain ways. And of course, I know where the structures are and what structure I'm touching, so I know what's damaged and what's not and what's okay. So it's very hard to explain. It's something that took me a long time to learn.
The first thing that people need to understand, in order to work on this sort of way, the first thing is that they need to come and see someone trained in your particular skills to actually touch the body, to understand what's going on. That pain, though it may be showing up in, say, the shoulder, could be referred, I mean, that's a common way of talking about it. It could have been referred from the lower back, or even the chest, or even a leg, or even a foot.
Yeah.
And that's the root cause of it. Is there anything else that people would like to know before I just ask you a couple of questions about Libby and also some other testimonials?
I think the main thing I'd like to share with people is that often the reason people get stuck in pain is there's three reasons. They get the wrong diagnosis of their symptom, or they get the wrong treatment based on the diagnosis, or they just get told nothing can be done. And the best example I have of that, or a good example I have of that, is a lady came to me with migraines and headaches. She was actually my dentist, and she'd had a diagnosis from the doctor, who diagnosed it as her age, which was brilliant. Not. And she was only in her early 40s, I mean. And she diagnosed herself, she thought it was a posture because her job was a dentist. So she got a diagnosis from a so-called expert and herself, which was both wrong. When I looked at her, it literally only took me 4 weeks to fix that, and she's not had the problem since. And she had it for months beforehand, and she was just living with it because she'd been given the wrong diagnosis. She had been to a couple of other therapists, and they'd given the wrong treatment because they just didn't know what to do. So be careful, because a lot of people, when you get diagnosed with something like sciatic pain, that's not a diagnosis, that's just a label for the symptoms. That's not a cause. Slip disc, that's not a cause, that's a label. Frozen shoulder, that's a label, it's not a cause. So just be aware of that.
Let's just cover a couple of testimonials. Let's find out what actually happened with Libby at the end, but you've got a couple of other people as well.
Two particular clients that stand out. One was a friend of mine who was actually with me at the time. We was out walking when she actually fell over and she sprained her ankle. And she sprained it pretty badly. She'd actually had a sprain like that when she was younger, and it took her a good 3 or 4 weeks to recover from it, to even be able to kind of walk relatively normally. It bruised up and swelled up almost instantly. I had to hobble her back to my place because she couldn't put any weight on it at all. And so I decided to use Richard's ACE on it, which was absolutely brilliant. I did 3 30-40 minute sessions with her over a period of 2 days. And within 48 hours, all the pain, all the swelling, all the bruising had completely gone. And she walked on it like nothing had ever happened. It was like the ankle had never been sprained or injured, and it just completely gone. That is completely unheard of. It's not possible, medically speaking.
Let's look at the other testimonial. There was another one with, before we go and talk about Libby to end, was with a boy who was an ice skater. And how did you work with that, and what actually happened? Because it's a really great story.
Yeah, so I worked with a young boy who was about 14 at the time. It was a couple of years ago now. And he is an ice skater. And he had a competition coming up literally a couple of days just after I saw him. And he'd injured his ankle and into his leg a little bit, up to his knee. And of course, that's the most important part for an ice skater. So he got referred to me. And there was nothing I could do traditionally to heal it quickly enough for him to be okay to do that competition. So I said to him, look, we can heal it quick, but you've got to do something a little bit weird. And he was up for that. And we just used ACE, and we went into the energy of the problem. We went into the energy in the leg and his brain and his heart, and we cleared it all out. And the ankle healed very, very quickly. He went off, did his competition. He was absolutely fine. And it went off really well for him. But there's no way that would have happened just traditionally speaking.
Okay, let's just conclude then with Libby's story.
So Libby is a classic example of someone who suffered for a really long time, and because she in the end she was just fed up with her pain, and she didn't need to be in that pain. I think that's very important. She was suffering with something that traditionally cannot be treated. Traditionally there is no cure for. But we was able to solve her pain in a relatively short space of time, even though it was a good 8 or 9 months. Compared to the length of time she had it, that was really quick. And she can now do everything that she couldn't do before. And she can do all the normal things. And since she's got rid of her pain, her arm has completely straightened, and her work and her career has just flourished. She's gone on, and her business is just taking off, which is what she always wanted to do. And before, her pain was kind of holding her back from that.
This is incredible work. This is truly healing differently, and Jonathan has taken this work to other levels, has got other techniques that he used on top of the ACE work that he learned from me, and he also teaches this material. So if you are interested in working with someone like Jonathan, go to richardfluke.com, hit Heal You, and that'll take you to another page, and you can fill out a form, and then we'll put you in touch with Jonathan. Someone will call you and see how that would work. Of course, if you're in the UK, it's fairly easy. If you're in somewhere, another part of the world, you may have to travel. But I do know that if you're in excruciating pain and being in something like chronic regional pain syndrome, just as Libby had been, you'd do anything. Having been in pain myself, you would do honestly anything. So, and yeah. Jonathan can certainly assist a person through that. He may have to see them a couple of times, but then the other work can be done via Skype or Zoom or one of these other types of things. If you want to learn about his techniques, then go to richardfluke.com, hit Heal Others. You'll get in touch with me, and then we'll talk about how we can actually make that happen. So it's been wonderful, absolutely wonderful as always to speak to you, Jonathan. It's such a pleasure. Let's just conclude then, Jonathan, because I'd like you to go back to your mission statement, because there's no way that you personally can heal 1 million people on your own. So, let's see if we can get more practitioners involved. Have you got anything else to literally just conclude this Heal Differently mini-series?
Yes, I'd love to teach other practitioners how to look at the body the way I do. I do think I look at the body very uniquely from other therapists. It's not so much about the tools I'm using, it's more about the way I look at the body and how I analyse what's causing the problem. And if I could teach more people that, then I could reach my goal of helping 1 million people out of pain.